Also, Living Well, which is in Geneva, is officially opening a Warrenville campus. So that is opening, I think, just in the next 2 weeks or so. I think May 2nd is the scheduled date. They are running an open house, so if anybody wants to join, you can find that online and sign up. Just for our purposes, we'll still be doing this online because there will still be some social distancing and mask rules since we fall under the hospital. That will significantly limit our size in person, and then I won't be able to, see your lovely faces. We're hoping that those things will be lifted in a number of months. And so once we can get enough room space where we could actually host enough of us, we'll still stream it for anybody who can't make it in person. But I know a lot of you wanted to get back to being in person, as I would love to as well. So hopefully in the next few months, that will happen. And then I just thought I'd give a little plug for the Metabolic Health Summit, which I just love, put on by some insulin and ketone researchers from Florida. That's happening the first weekend in May. So I'll be headed to Santa Barbara for that meeting. And I thought maybe we'll see some great new science that we can present next month if anything jumps out at me from a cancer or other metabolic health perspective. Okay, so today we'll go through just a couple of whys and hows, but answering a lot of questions that have come up. So thank you for submitting questions and topics. But first, why or how does a low carbohydrate, high fat diet, ketogenic diet work? So the question is, working from a weight perspective, working from a cancer perspective. So the basis of eating this way is that when you lower your carbohydrate intake, it lowers your blood glucose response and thus lowers your insulin response. And insulin is the hormone that actually tells the body to store fuel. So again, storing sugar into glycogen stores, storing fat into fat cells. But when insulin is low, that's when the body is told to go ahead and pull that fat out of the stores that you stored to burn later and to burn that for fuel. Insulin is also a growth factor for cancer. As we know, we've gone over this numerous times. So we know that when we lower insulin, we've seen data that has showed slowing of cancer growth. But more importantly, from a day-to-day, we keep blood sugars low and stable. It improves our energy level. It makes us feel great. It doesn't provide any of that anxious and hangry times in between meals. And of course, it provides less fuel for the cancer cells. So when I say, let's eat a lower carb diet, it was really to stay off this sugar roller coaster, which really wreaks havoc throughout our entire system. And why is it called ketosis? Well, when fat is burned for fuel, fatty acids and ketone bodies are produced, so generating ketones or ketogenic. When you are in ketosis, it's really interesting. It tends to be weight self-regulating. So if you're overweight, you tend to burn fat, you lose weight, you slowly come back to kind of a normal weight or what your body might think is normal. And if you are underweight, it has been shown to improve body composition, increase lean mass. So if you're underweight, it puts weight on. If you're overweight, it takes weight off. So it's a really nice self-regulating way to be. When you're in ketosis, it allows those hormones to function properly, predominantly that leptin and adiponectin signaling, which tells us, are we hungry? Are we not hungry? There are many people who have insulin resistant who are also leptin resistant, and leptin then doesn't signal properly. It never tells the brain that you're full. And so even though you eat, your brain is still thinking you're hungry. And so that's one of the reasons why eating a high carbohydrate diet can, and being insulin resistant can lead to weight gain. In addition, when you are in ketosis, it allows for what's known as autophagy, or the recycling of cells and cellular byproducts. So when you have damaged cells, the body then is able to dispose of them. So instead of maybe having a damaged cell that goes on to become a cancer, kind of, weeding the grass as we go. Ketones have also been shown to be anti-inflammatory and immune boosting. So changing some of those metabolic features that have shown improved cancer fighting abilities. And I often get, do I actually have to be in ketosis? And the question is, well, what is your goal? If you're just looking to lose some weight, you maybe don't need to. You need to lower insulin, so you maybe need to lower carbohydrate. So there are diet trials out there that show that you can lose weight a lot of different ways, and you can lower glucose and insulin a lot of different ways. But if you have active cancer or undergoing active cancer therapies, I really do encourage being in a ketogenic state, because I do believe that that improves our cancer outcomes and improves our toxicity outcomes from therapies, and that we've gone over in prior lessons. And I would say that if you want a little bit more on how to monitor your ketosis, that go back to the January talk. I think we talked at that time about measuring glucose and ketones in GKI and some of the data behind that. Although it's limited, it is interesting and intriguing and seems to play over and over. So what we know is that the first step really is cutting out those sugars, the overly processed carbohydrates, and the man-made oils, those vegetable, nut, seed oils, and focus on real food. So if we start with real whole food, that is an awesome first step. And you may get some great benefits as well as energy level benefits. Maybe just eating a basic low carb or paleo, primal, Weston made price, Whole 30, you name it, Mediterranean low carb. But I will say that if you're really insulin resistant or really have a carb addiction, that just going low carb doesn't always fix the problem. So we tend to kind of be in a little bit of a purgatory. You're in between, your body is still craving those carbohydrates, and you're not low enough to have kind of stopped that signaling, that stalling. So if we can get that down all the way, then all of a sudden the cravings seem to dissipate. We kind of break stalls in weight loss. And there is some question of, do we truly get the full metabolic benefits unless we're in a ketogenic state? And we don't know yet truly how deep of a ketogenic state we need to be in. And there's a breast cancer, I believe they're all stage 4 metastatic breast cancer patients in a trial being done at the university, or at the Ohio State University. And they are seeing some really impressive results. And I don't know that they are in super deep ketosis, that they're just measuring ketones, and as long as they're kind of above 0.5, they're considered to be in ketosis. So that'll be interesting to see their results as they get further into their study. And then I always hear the question, do you need glucose for your brain? Everybody says you need at least 130 grams of carbohydrate or of glucose to support your brain function. And I will say that, yes, your brain does need glucose, but you don't actually have to eat it. Your liver will make as much as you actually need. And interestingly, your brain actually really loves ketones, and why ketogenic diets and exogenous ketones, those are ketones that you might take as a supplement, have actually been used in neurologic diseases. And I'll see more always at the Metabolic Health Summit. There's always neurologic talks, but super interesting stuff. But I want to go way back. So in 1971, Dr. Cahill did this study just kind of looking at what happens when you fast a patient. So he actually fasted patients for you. If you look at that timeline at the bottom, day of fasting, for 40 days of fasting, and watched what happened. So glucose, which is, hopefully you can see it, it kind of dropped in the first couple days, and then it flatlined. So basically you kind of burned through the available glucose, the glycogen stores, and then the liver just took over, making this basal amount, and kept glucose levels extremely stable. And during that same period of time, the body started making ketones, and then it continued to make ketones up to maybe 20, 25 days, and then that leveled out. So you didn't go into what's known as ketoacidosis. So ketoacidosis is where ketones go out of control and glucose go out of control. So very different. This is considered a very normal fasted state or ketogenic state. So number one, this shows that you can not eat any glucose because you're eating zero fat, protein, glucose for 40 days, and these patients did quite well. Then he looked at what happens to brain. So this was actually done earlier in 1968, but he looked to see what actually does the brain consume in a normal or in a fasted state. So in a normal mixed diet state, so a non-ketogenic diet, the brain is in fact consuming 100% glucose. And this is one of the issues why Alzheimer's is actually considered type 3 diabetes, because in a normal patient where really the only fuel you have is glucose, is Alzheimer's patients can start to get neurologic changes because their brain has become insulin resistant. So they are not utilizing the glucose that's in the system. But interestingly, during starvation or a ketogenic diet, so kind of mimicking starvation, you start to create, again, a bunch of beta hydroxybutyrate. And what has been shown is that the brain really can operate on a small amount of glucose, and it actually uses far more beta hydroxybutyrate, acetoacetate. Those are two different types of ketone bodies. And so these folks actually did quite well. And this was, I believe in this study, they fasted the patients, and maybe it wasn't in this study, but they watched glucose. They fasted these patients for, days on days, and then they actually injected them with insulin. So they further pushed their glucose down. And they had glucose levels. So as you know, normal glucose levels might be 80 to 100. Sometimes in fasting, it can get lower. Some people will get as low as 60, maybe even the high 50s, and feel completely normal. And these guys, when they injected injected insulin, their glucoses went down to like 30, 35, and they were completely normal. Their brain was operating fine. They noted no ill effects. So I think that when you are in a ketogenic state, fasting becomes very easy. Your body loves to use ketones. There are some organs that need a little glucose, like the brain, like red blood cells, like the parts of the kidney, and your liver will produce what you need. So there's no fear in needing to consume any glucose, because again, your body has outstanding mechanisms to ensure survival. Can you eat fruit? This is a very common question, because you get the whole thing about, wait, I thought fruit is good for you. Well, number one, I went through, this is from Diet Doctor. They have some nice visual food guides, and this is just looking at various fruits, and the numbers are green and orange and red. Those are the amount of net carbohydrates per 100 grams of fruit. So again, 100 grams of fruit is not necessarily a piece of fruit. You'd have to, search it to figure out exactly how many, what's a medium banana, how much does that weigh? And then net carbohydrates are a little bit tricky. So net carbohydrates are total carbohydrates minus fiber, because we know that fiber does slow the glucose response. But depending on your insulin resistance or sensitivity, you may need to be looking at total carbohydrates, which are going to be very different than net carbohydrates. So I usually say that fruit, if you are very insulin resistant, really should be eliminated, or at least significantly limited. Maybe a handful of berries, now and again. But just so you know, I tend not to eat fruit. I might have a bite now and again, but I rarely have it as a serving or as part of a meal. And this is something about food composition. This is, some of you have seen this before, but it's why I'm not a fan of smoothies or of juicing. But in the first graph, this is various forms of apples and the changes that happen in glucose. So one of them is just eating a regular apple, and that has a nice spike in glucose, and then it comes back down within about an hour and levels off. Again, these responses are going to change based on the health of the patient. So a normal patient versus a pre-diabetic patient versus a diabetic patient are going to have different responses, but this is kind of a general response. And when you puree it, they did what's called a slow puree and a fast puree. And the slow and fast just meant how fast did they drink it? So did they drink it slow over the same amount of time it took to eat the apple? Or was it, and when I say apple, I believe they gave total of 60 grams of carbohydrate in each form. So it was the same amount of carbohydrate in different forms, and then of course slightly different times. But you can see that even though the apple kind of went up and then it flatlined sort of, the other ones had a real big dip in the glucose level. And what that tells us, if you understand glucose and insulin, is that insulin was too high. And if you look at the next graph, you can see some of the really high peaks in insulin. So the apple had a relatively medium peak with a kind of a falling out, and then the fast puree had a similar glucose and insulin spike, although it did have a little bit higher spike because it did have a little bit more of a dip, but not nearly as bad as the slow puree, the fast juice, or the slow juice. So the worst was drinking your juice slowly. It seemed to give the highest glucose peak, but more importantly, the highest and bigger insulin peak. So we're always trying to minimize that insulin, because insulin, again, is that driver, that growth factor for cancer. So if we were going to have an apple, we would want to eat it in its whole food form. Although I choose not to have that, because for me, that causes too high of a sugar and insulin response. And interestingly, this is how our food has changed over the years. So examples of fruit. So bananas used to be mostly seeds with a little bit of fruit. And you could imagine how hard it would be to get the flesh away from all those seeds. It wouldn't be the most fun thing, but you would eat it potentially if you didn't have anything else to eat. But same with watermelon, lots of seeds, not a whole lot of the pulp. But if we breed it to have less seeds and to be bigger and sweeter, really not likely to have been a big source of calories for our ancestors. So maybe they had it if they couldn't find anything else, but it seemed like a lot of work without a whole lot of reward. So not probably the best food choice for us. But of course we should eat fruits, right? Because of all those vitamins and minerals. Well, if we look at the best sources of vitamins, you can see that there are some fruits, and I kind of crossed out the fruits with the red, because those are things that would not necessarily be considered optimal in a ketogenic or low carb diet. And then carrots are in there and pumpkin, so a couple of the starchier veg. But if you look at all of those food choices or options for our good vitamins, we can see that the majority of them are animal foods and low carbohydrate vegetables. So another reason why a ketogenic diet may be optimal, because you're choosing the foods that actually have the densest source of vitamins. And if we look at a handful of minerals, this is comparing beef and beef liver. I know most of you don't probably like beef liver. I'm not a huge fan, but I do it in certain dishes. But you can see this is for 100 grams of each food. So by weight, you would need to eat far more apples, blueberries, and bananas to get, anywhere really close to beef. So animal foods still are pretty nutrient dense, both from a protein perspective, from a fatty acid perspective, as well as from a vitamin and mineral perspective. So I want us to get out of the mindset that fruit and vegetables are where we find our vitamins and minerals. I would say that animal foods and above ground vegetables are probably our best sources. And then I always have the question of, but what about saturated fat and cholesterol? Aren't we supposed to avoid them? And I've done very long cholesterol lectures in the past, and there's a lot up online, but I'll just go through a few brief points. But bottom line is our cell walls, pretty much all of our cell walls are made up of a lipid bilayer. This is actually made up of fat. This is how our how things get transported, signals, proteins, etc., through this nice normal phospholipid bilayer. The fat carries our fat soluble vitamins. So vitamins A, D, E, K, those are fat soluble, meaning that if you are taking, vitamin, that's why vitamin D comes in a little oil capsule. Vitamin E comes in a little oil capsule. Same with actually K2 may or may not. Actually, all of them may or may not. Some of them do come in an oil and some of them don't. But if they don't, then you need to take it with fat so that it gets absorbed. And your brain is actually made mostly of fat, and it's mostly DHA, which is an animal omega-3. If you eat a plant omega-3, ALA, a very, very small percentage is actually converted into EPA or DHA. And, it's a continuous process. But, and then the myelin sheath, so the coating on the nerves are also made of fat. So that's what helps conduct our electricity, our nerve impulse down our nerves. When that myelin sheath is disrupted, we can get some neuropathies or numbness, tingling, pain, maybe even paralysis. Cholesterol is actually a precursor to hormones, and vitamin D is actually one of those hormones. So again, fat and cholesterol is actually very important in the health of our cells. So what's the difference between all these different types of fats? Well, saturated fats are fats that are they're saturated. They have hydrogens on all the carbons, so they're very straight. An unsaturated fat, which can be mono, meaning one, or poly, meaning multiple, are missing a hydrogen. And so they can be a little bent. The one on the bottom, you can see this is a triglyceride, so 3 fats. And the bottom one is monounsaturated fat. It has one missing, or has one double bond, I should say. So one double bond versus multiple double bonds in polyunsaturated fat. And then those can be either omega-3 or omega-6. So depending on where the double bonds are happening. Hydrogenated, so when we think of trans fats, what factories, what man has done is taken an unsaturated fat and added hydrogen to it to make it saturated. That is a kind of fat that is actually not very healthy when we physically change those fats. In addition, we'll talk a little bit more about omega-3s and omega-6s, but this is the availability of added fats, so added dietary fats. And back in the day, we used to do a lot of cooking with lard. That was the main cooking fat in restaurants and deep frying and things like that. And in the household, it used a lot of butter. And then at some point, we were told that those animal fats are bad and we should be using these plant fats. And you can see that there was a rise in the use of margarines and significantly in vegetable oils. And sadly, those have continued to rise and rise and rise. So more fats in the American diet, and the majority being these vegetable oils. So when we look, those vegetable oils are predominantly omega-6 sources, and those go down the linoleic acid series. arachidonic acid is from animals, but those come from natural sources. And I will say that omega-6s, and we'll talk a little bit more about this, we certainly don't want a predominance of omega-6 to omega-3, and that has been shown to be significantly bad, both from a health, weight, and cancer perspective. But omega-3s, again, we talked a little bit about ALA, so these plant sources of omega-3s don't convert very well down this pathway. So really the best thing to do is to consume good sources of EPA and DHA, which would be your oily fish, your grass-fed meats, grass-fed dairies. And I will tell you that linoleic acid will go down the pathway as well, and so it will also create more arachidonic acid. So it's not usually the level of arachidonic acid is typically more related to the linoleic acid intake than it is to the meat intake. And I wanted to show this, so sorry for the gruesome picture of dissected mice, but I wanted to show, this is looking at belly fat. So different levels of what we would call visceral fat or adipose tissue. It's the white shiny stuff. And if we go through each of these columns, the first one is a very low amount of linoleic acid. So 1% of the energy consumed was linoleic acid. And in the top row, these are all medium fat diets, and then in the bottom, a high fat diet. And you can see that when the mice were consuming only 1% of energy from linoleic acid, regardless of whether they were eating a medium fat or a high fat, they had similar amounts of belly fat. And as you got into the next group that had a very high amount of linoleic acid, the 8% of their dietary fat or energy from linoleic acid, the medium fat diet had much more visceral fat, and the high fat diet had even more visceral fat. So very significant increases in the amount of visceral fat with a high linoleic acid diet. And interestingly, if the animals, and this is still in my opinion far too high in linoleic acid, but if those mice also were given EPA and DHA, they had very much less visceral fat. So if you are dealing with some belly fat and you're already following a low carbohydrate diet, you might want to look at the amount of linoleic acid that you are consuming. That is a big issue. And I have seen people very commonly have both insulin resistance and high omega-6 levels, but I have seen, all mixes. So high insulin and low omega-6s and vice versa. So again, always think about the energy being consumed from linoleic acids. And I guess, I went ahead and circled that the worst situation was high linoleic acid, high fat diet, and no omega-3s. So think about that as you choose your foods. This was a study that was actually looking at the concentrations of linoleic acid, so this omega-6 linoleic acid, in the fat cells or the fat tissue of adults. So you can see how the amount of linoleic acid stored in our fat has slowly risen from under 10% to over 20% from 1955 to 2005. So pretty dramatic increase, more than doubling over 50 years. And this was a picture out of a Handbook of Nutrition, Diet, and Epigenetics from 2019, looking at some of the things that can happen when you are consuming a high corn oil diet, that would be a high linoleic acid, versus a high extra virgin olive oil diet, which would be high in monounsaturated fat. So this was looking at different things. So they noted increased growth in sexual maturation or earlier sexual maturation in the corn oil diet, that there was not the carcinogen detoxification, so more carcinogen. There was more changed the proliferation, apoptosis. Apoptosis is cell death, so increased growth, decreased cell death in the high corn oil diet, increased differentiation, increased oxidative stress, increased some DNA damage, increased gene expression. So the curves, the blue curve is looking at the control, and then the high olive oil diet was green, so not statistically different, so low degree of malignancy. But if you looked at this high corn oil diet, you can see the tumor-bearing animals significantly increase, so a high degree of malignancy in those animals fed a high corn oil diet. And this was a study that was done. It was actually done to look at reduction of heart disease, and this was called the LA Veterans Trial. But they had veterans living in group homes, and they fed them. This was a double-blinded study, so the patients nor the researchers knew what the patients were getting, but the veterans were given either low or high polyunsaturated fat diets, and they found that quite a number of cancers were higher in the experimental group. So even though there was a slight reduction in cardiac risk, there was actually a higher cumulative cancer deaths. So there, I don't believe there was any change in the overall mortality. So we've kind of heard about this French paradox, or maybe it's total European paradox. This is courtesy of Dr. Andreas Einfeld, who's the lead of the Diet Doctor website. But what they found is that those countries that were eating more saturated fat seem to have less heart disease. And so why is that? And again, the way I see it is, if you have a paradox, it means your theory is incorrect and you need to rethink it. And this was interesting, where they looked at patients who were hospitalized with coronary artery disease. So they were hospitalized for coronary artery disease and looked at average lipid levels. And in this group, only 21% of the patients were actually on lipid lowering medications. So this is not, they didn't have low cholesterol because they were on lipid lowering medicines, although some of them did. But the average patient had a normal total cholesterol and essentially a normal LDL cholesterol. But what they had, and what I think is significant, and why these are the two factors that I look at in a cholesterol panel, is they had elevated triglycerides and they had very low HDL. So that combination is actually very consistent with insulin resistance. So when I see a high triglyceride and a low HDL, the first thing I think of is insulin resistance. So heart disease is really a finding of insulin resistance. And there was another study that looked at patients that were admitted to the hospital for any cause, so just hospitalizations, and we see the same thing. So lower total cholesterol, lower LDL, high triglycerides, low HDL. So that triglyceride to HDL ratio, again, is very indicative. And we can see the same thing actually in cancer. This was a trial or a study that was done in triple negative breast cancer patients. And in C and D, so the top two, looked at overall survival and disease-free survival. So that just means that whether patients were alive or not, and disease-free survival means whether or not they had cancer or not. So did they have a recurrence or not? And what they found is that those patients who had a lower triglyceride level had lower rates of death, and those who had a higher level of triglycerides had higher death or lower survival. So the green lines showing lower survival were patients who had high triglyceride levels. And in the bottom two, those are looking at the triglyceride to HDL ratio. So taking the triglycerides and dividing it by HDL. So if you have a low number, that means you have low triglycerides and high HDL, and those patients did better than the patients who had high triglycerides and low HDL, so that they had a higher ratio. So we can see that there is something to be said about the triglyceride and HDL information in a cholesterol profile. So that is important to look at. So we can't just ignore and think that cholesterol is about heart disease, and it applies to all disease. And why do I, again, recommend low carbohydrate and ketogenic diets? Well, this is Authority Nutrition did a nice summary up to including 2012. Sorry, I haven't updated this. I'm not sure if they have. But they compared low fat versus low carb diets, low carb being the blue bars, and you can see that triglycerides are consistently decreased and to a greater degree with a low carbohydrate diet compared to a low fat diet. And when we look at HDL consistently goes up and to a greater degree than compared to low fat. And in fact, low fat actually has far more reductions in HDL. I usually say the way to get HDL up, besides activity or exercising, is increasing your saturated fat intake. So when we increase saturated fat intake and we decrease carbohydrate intake, we actually improve our triglyceride to HDL ratio. So what is my take on fat? My take on fat is that we should definitely eliminate man-made oils. So the vegetable, nut, and seed oils. I am okay with olive oil. I usually say fruit oils are okay, which would be our coconut, our avocado, and our olive. I do recommend that you check for quality. They can be adulterated to some degree with the vegetable oils, with the polyunsaturated omega-6 fats. And they can be kind of sneaky about it. So I think the rules, are that they don't have to label it unless it's a certain amount. Don't be afraid of eating the fat in animal foods, the saturated fat. Eat the fat that nature puts in real food. That is healthy fat. Healthy fat is fat that's supposed to be there. I also say don't overeat nuts and or seeds. They are actually quite high in omega-6s, and we wouldn't normally eat a bunch. If you've ever eaten walnuts back in the day right off the tree, you had your big nutcracker, and it took a lot of effort to get those two little halves out of the shells and eat them. And that's about what we would have. And so it would be a whole lot of work for a whole little gain. And we probably wouldn't eat too many of them. So I usually say, please moderate the nut and seed intake, because I've seen people get into trouble with overeating nuts. And eat fatty fish for sure. Get great omega-3s. You're looking for those EPA and DHA, and that's most commonly in fatty fish, but will also be in well-raised beef and other red meat or ruminants, as well as some grass-fed butter. And if you follow a low carbohydrate, high fat diet, you are optimizing your cholesterol levels, you're optimizing your brain, and nerves, you're optimizing that low inflammatory state, and you're improving your immune system. So lots of benefits for high fat diets as long as you are eating the proper fats with very little carbohydrate. Make sure that you read labels on any prepared foods. I have seen omega-6 oils, so soybean oil, listed in rotisserie chicken, in sausages, in other prepared foods. So even if you think, oh, I'm getting a chicken, if somebody else cooked it, made it, it may very well have some of these seed oils. So just be aware. Even in supplements, I've mentioned this multiple times before, but many vitamin D supplements will be made with seed oils. So just double check, read all of your labels, regardless if it's a food or a supplement. But ideally, our foods will not have labels because they will come straight from nature. Okay, so as per usual, KessRx, send me any questions, any topics, happy to address them. And again, I'll be going to that conference, so we'll be looking for any interesting new data that has come up. Remember about our the June 4th Bridge Walk, the open house for the new Warrenville Living Well campus, and I will see you next month.